My name is Carrie Walker, and I'll be facilitating a brief presentation on how to reduce your risk for falls from the Village. Please keep in mind that this presentation is designed for educational purposes only and is not intended as a substitute for advice from your regular healthcare professional. Every 15 seconds, an older adult is seen in the emergency room for a fall-related injury in the United States. The primary reason centers around changes to your body and physical abilities as you age. Conditions associated with aging can include muscle weakness, especially in the legs, balance and gait problems, postural hypertension, which is a change in your blood pressure producing dizziness as you go from either a lying or sitting position to a seated or standing, having slower reflexes, sensory problems such as changes in vision or neuropathy, confusion such as dementia, taking multiple medications, as well as wearing improper footwear. Good news is that the large majority of these variables are able to be addressed to decrease your risk for falls. For example, you can become more physically active. Becoming more physically fit can help you increase your strength, improve your balance and reflexes, and potentially reduce your reliance on certain medications. Regularly review your medications with a doctor or pharmacist if you're taking quite a few. You can take a look and choose better footwear. You can have your vision, hearing, and blood pressure checked, and you can also make changes in your home. Before we go on, I wanted to include a slide here, because many times I don't think we have an accurate, neutral view of our bodies in terms of shape. I'd like you to look at your body in the mirror and evaluate it based on physics and risk factors, not in terms of self-value. Being obese, particularly if you're carrying your weight in your stomach, changes your center of gravity, putting you at a higher risk of tipping over if you look at this model here. Being overweight, particularly having that belly, can make it difficult to accomplish regular movement patterns, such as tying your shoe or reaching down. This might cause you to use a different pattern of motion that's going to put you at a higher risk for falls. Being out of shape makes you prone to tire out quickly, not be as careful. It decreases your reaction time and decreases muscle tone to withstand unexpected jolts or uneven surfaces. When you think about adding activity into your schedule, you want to make sure that exercise includes some different things from each of these four categories. Endurance activities increase your heart rate, like walking or swimming. This will lead to an increase in your stamina so that you won't tire out so quickly or so soon. Building strength is necessary to maintain muscle. We lose muscle significantly as we age. This means that if we're not actively trying to gain it by doing regular resistance training, we're actually losing it. Balance and flexibility are also important to keep full range of motion at the. Notice that the medications on this slide are commonly prescribed, such as antidepressants, anti-anxiety drugs, antihistamines, blood pressure, etc. Sometimes the problem isn't a single drug, but the combination of medications taken together. Older adults are especially vulnerable because drugs are absorbed and broken down differently as their bodies age. If you're concerned about how your medications may be affecting your balance, make sure to talk to your doctor about reviewing the drugs you're taking as well as the dosage. Keep in mind, though, it's never a good idea to just stop taking a medication without first consulting your healthcare provider. Screenings, regular medical screenings, are extremely important because they function as numbers on the dashboard of a car, giving you an idea of what's happening under the hood of your car, which in this case is your body. Some people have increased blood pressure when they're seated, but yet it drops too much when they either go from a seated or standing, a lying down or seated position to a standing or seated. So you want to make sure that you note any changes with your doctor. Have your vision checked regularly. Even small changes in sight can make you less stable. Lastly, get your hearing checked. Not being able to hear well can impact your balance by causing you to not become aware of somebody approaching or a pet until the last minute, causing you to lose your balance. Our feet have nerves that help us judge the position of our bodies relative to the surface we're standing on. To work correctly, our feet need to be in touch with the ground as we take each step. Choose shoes that completely surround your foot and have non-slip soles. You want to consider that if your strength, reflexes, and reaction time have changed over the years, it may be time to reevaluate the type of footwear that you're wearing. In the next few slides, we'll take a look at what you can do to reduce your risk for falls by changing and making changes in your home. An important step toward preventing falls at home is to remove anything that could potentially cause you to trip or slip when walking. It's important to assess your house through fresh eyes and look at the placement of objects through the eyes of whether or not it's a trip hazard. For an example, keeping all of your knitting supplies next to your easy chair where you regularly knit might make sense from a functional standpoint. However, it may also pose a trip hazard when you're not knitting if you need to get up quickly. If you're beginning to feel less steady on your feet and don't currently use a cane or a walker, consider installing railings in the hallway or additional grab bars. However, prior to installing either of these, make sure to have a reputable contractor assess the placement of them to ensure that they're installed correctly and also will be able to support your weight if needed. You might find it helpful to arrange often used items in your house to make them more accessible. Store food boxes, cans, dishes, and clothing, everyday items within easy reach. This simple change could prevent a fall that might come from standing on a stool to get an item or leaning precariously over. If you do end up falling, it's important to talk to your doctor about the fall because there might be underlying causes that you're not aware of that are putting you in this position. Write down the where, when, and how. This will help them assess whether a medical issue was the cause or that something else that needs to be addressed, perhaps one of the items that we mentioned in this presentation. Knowing the cause will help you plan to prevent future falls. And lastly, you want to address the fear of falling. Pay attention to your concerns so that you don't miss out on the opportunity to make easy adjustments currently that will help keep you safer in the future. Thank you for joining us. I hope that you found this information helpful.